My name is Kostas Tsitskaris. I'm a consultant orthopaedic surgeon at the London Independent Hospital. I'm a specialist in the treatment of hip and knee joint conditions, and I would like to talk to you about knee replacement surgery today. And it's worth starting with the symptoms that people commonly present with. And it's fair to say that the most common symptom really is pain. Pain across the knee joint, or sometimes pain on the one side of the knee. And it's important to clarify where that is. Very commonly, people will also mention a tightness in the joint, essentially stiffness, and they may also have swelling, either occasionally or more permanently. Many times they will also mention that they have noticed a change in the way that the leg looks. It's a deviation from the normal alignment, if you wish, and sometimes they will have bowing, for example. Occasionally they will also say that their knee doesn't support them very well anymore, and they usually refer to it as giving way. With all these symptoms in mind, it's important to get some investigations and identify what the pathology is, and also get an understanding of how severe it might be. And we usually talk about osteoarthritis, really, and the baseline investigation is really X-rays. We call them radiographs, but most people refer to them as X-rays. And we will get a number of different views, and that will most of the times help us understand where the problem is and how bad it may be. Occasionally, a more detailed scan, such as an MRI scan, may be necessary, and on some occasions even a CT scan, but those can be organized on an individual basis. Of course, a clinical examination is very important, and it will help us further understand where the pain may be centered, and crucially, whether there is also a possibility that the pain may be coming from elsewhere. And I usually tell my patients that it is not uncommon to have two different problems at the same time. At this stage in my practice, I find that this is very important, that I understand more about the patient in front of me and their individual circumstances. So I want to know more about their lifestyle choices, and also what are their aspirations and expectations from any potential treatment. And given we have all of that already, we should by now have a diagnosis, and then we can always talk about treatment options. And for those individuals who are suitable for surgery, really when it comes to knee replacement, we mainly talk about either a total knee replacement or what people call a partial knee replacement, or otherwise known as a unique compartmental knee replacement. It's a long term for essentially replacing part of the joint, to be honest. Very few individuals with osteoarthritis may benefit from a lesser invasive procedure, such as an arthroscopy, but again, this has to be looked at on an individual basis, and it usually has to do with a specific set of symptoms. We call them mechanical symptoms, and it's worth going through those with the individual patient. Now, in summary, if you are troubled by any of the symptoms I mentioned, it is certainly worthwhile visiting us at the London Independent Hospital. I will be perfectly happy to take you through the process and identify the diagnosis and discuss treatment options for you. The process for surgery is actually very well organized. It's something we do quite often here. So you will need to expect that you'll have a pre-assessment appointment where you will discuss a number of issues with the team in terms of how to prepare for the surgery, and also will undergo some investigations to make sure that you're healthy enough to have this procedure. The procedure happens on an inpatient basis at the moment, which means that you will come in and you'll be expected to stay with us for potentially 1 to 3 nights usually. And following the procedure, you'll have the usual treatments for pain relief as well as physiotherapy, all organized here in the hospital. This will be the initial part of the rehabilitation, the rest of which will continue at home under the care of physiotherapists, and then of course we'll have a follow-up appointment at some point in the clinic to see your progress. Most people with joint replacement surgery, especially of the knee, will need to expect that they will require approximately 6 weeks and potentially up to 3 months before they're fully back into their normal activities. And of course this depends on what their activities are. I would certainly recommend that they organize for at least 6 weeks off work for most types of employment.